The way we described it was like going to work in an ED in Beirut or a war zone. That's how it felt.
It was such a chaotic environment before. Staff didn't know what to do first, where to focus their energies first, what was going to be the priority for the day.
Walking into the A&E department, you would look around and you would sometimes think, even after 16 years in the service, I'm not quite sure where to start.
The A&E department was getting backed up. We were struggling to offload ambulances. The back door of the hospital wasn't actually meeting the front door's requirements. Patient flow, well, there was no flow.
Patients were there in the ED department for considerably longer than they should have been.
The organisation was sitting somewhere between 75 to 85%, which was well below the national standard.
The biggest problem was maintaining patient safety, really.
Anyone who's in the A&E department longer than 4 hours is exposed to more harm, more potential for harm.
We didn't have the space to treat patients as they should be treated, maintaining their privacy and dignity.
It also made it difficult to recruit and retain staff because people felt quite demoralised to work in that kind of environment.
So a fairly poor experience all round, both for patients and for staff.
It almost felt like no one was taking overall accountability and responsibility for the flow of patients within the organisation.
People had become desensitised. It almost felt out of their control to deliver any changes.
There wasn't really an awareness that the problems spanned greater than our department.
So the hospital worked very much in isolation from its partners. There was no collective ownership of the emergency pathway between the hospital and stakeholders who provided community and social care services.
There was a lack of pace when it came to discharging patients.
Absolutely not a feel of a whole hospital ownership of flow through the hospital. So we haven't done anything very clever, but what has happened here is that the hospital has started to take ownership of the whole pathway.
The full capacity protocol was implemented. Each ward took an extra patient and it just enabled the risk to be spread somewhat.
Wards were tasked with creating a certain number of beds before midday each day.
We've improved the structure of the operational bed meetings, so there's a minimum of 3 meetings per day. We're looking at every patient in the organisation who's been in a bed for over 20 days, just making sure that everything is on target to make sure that patient can be discharged in a timely manner.
The partners have done a huge amount of work through something called the Joint Assessment and Discharge Team, which is health and social care and community service working together.
We are responsible for complex discharges, so mainly those who require social care intervention on discharge from hospital or those who need health support on discharge from hospital. The vision of the JAD is to work in partnership with the Trust to ensure that there is adequate patient flow.
We implemented a system in the emergency department that we call RAT, and that stands for Rapid Assessment and Treatment. We put the senior clinical decision makers at the front door. The patients were seen by a senior doctor and a senior nurse fairly soon after their arrival, and the decision was made where to treat those patients, and they were being treated by the right people at the right time in the right place.
We've increased the capacity in the A&E department, which was important. That gave us about 22% extra cubicles.
Patient flow has improved. It's not 100% better, it's not fixed, we still have problems, but it has improved.
Certainly patients that come in by ambulance are met with a better response, therefore letting the ambulances go back out on the road, and patients that need admitting have got a bed to go to rather than sitting in an A&E department for 24 hours plus.
It's a better patient journey, better patient experience, and it's safer.
We don't dread the on-calls so much now.
Staff feel in control. They know what's happening. They know what they need to do.
You go home at the end of the day and feel like you've done a good job.
But now that things are getting better, we are retaining staff, and also people are now choosing to come and work with us.
Basically, we've got an emergency department back.
Happy staff, happy patients, happy work environment.